Good evening, folks, and welcome to another edition of An Hour with Bob. How do you like my suntan? You can't call it a suntan. I get burnt. I'm light-skinned, Irish, Italian, Frenchman over here, whatever I am. But I'm mostly Italian, remember that. Hi, folks. My name is Bob Venturini, and I am your host on An Hour with Bob. And tonight we're going to have some fun, as we usually do anyway. But get your pens and your paper out because you're going to learn some stuff tonight. Because we got two authors tonight. One's going to talk about families and children, and the other one's going to talk about Medicare, but fun stuff. And we got one of our local favorite bands. They've been on the show a number of times, and they're one of my favorite bands. Well, it's a duet tonight. They played as a duet, they played as a band, they played as a solo. They've done it all. And Jesse and Jack Gauthier. Is that the name we're using tonight? Jesse and Jack? Or are you dishing your father again?
No, that's, I guess so, but that's our birth name. But
that's your birth name?
Thanks, yes.
But we go by Jesse Liam.
I named you.
Liam's my middle name. So
Liam's
we go
your
by
middle name.
Jesse Liam.
Yeah,
it was his idea, so I didn't really push
The Jesse Liam
him.
Band.
The Jesse Liam Band.
Yes.
Created by Jack.
No, Jesse.
Created by Jesse?
But the name, he approved it.
He approves it.
Yeah,
All right. Well, and you got another CD out, I see, right?
Mm-hmm.
Our fifth one.
A fifth CD. We got to get a shot of that later. We got the CDs on the floor there. We got to get a shot. This is your fifth CD. All four, the other four are down there, or all five of them are down there.
Yep.
All right, but this is your new one here, right?
Yes.
And when did this come out?
This summer.
Yeah,
Yeah.
this summer.
June.
You've been playing a lot, huh?
Yeah.
Mm-hmm.
I see you all over the place. You're around more than I am, I
I
think.
hope that's good.
Yeah. No, really, you're doing great. I mean,
Thanks, Bob.
Thanks,
two or
Bob.
three times a week you're playing all over the place, right?
That's a slow week, Bob.
Yeah, huh? All right, we'll be back to you in a minute.
All right,
I got to
thanks.
say hi to my beautiful guest, and I think she's going to be my co-host tonight because
I'm
this
totally
girl
fine
is
with
stunningly beautiful. How you doing?
You're making me blush. That's okay,
Jan?
Bob.
Now, we were talking about it before. Jan is Cornell now.
Yes, sir.
Now, what was your name? Sutton? What was your maiden
Sutton.
name? Sutton, right?
Yes.
I met you, 20-something years ago?
Roughly.
And you were,
Take it easy on the years.
take it easy on the years. Come on. Is there anybody that's aged better than this girl?
Stop it.
Oh, my God. 20-something years ago, you ran for Miss Rhode Island.
USA.
And?
You were a judge.
Yeah. And?
I won.
You won. And then recently, you ran for
Mrs.
Rhode Island.
Yes.
Oh, I thought you put the air conditioner on for me. Oh, it is on, John? For Mrs. Rhode Island.
Yes. And then recently, I just published my very first book.
And you have two children.
I do.
How old are they?
I have a 3-year-old daughter, Katie.
And a boy that's how old?
He's 7, going to be 8 soon.
Going to be 8 soon. I love when people say that. There's going to be some.
Well, it's always very exciting to count down the months for the next birthday.
I love when people say that. Yeah, I'm 30. I'm going to be 31. No, I thought you were going to be 28. No. Usually means that the next is coming, right?
It is.
Oh,
And-
how soon?
Okay, so it's several months away still.
Several
But
months
you're-
away. My birthday's Sunday. Now that's soon.
Happy birthday.
That's soon.
That's exciting.
No, it's not
Well, with the
exciting. It's
children-
exciting when you're 12. It's not exciting when you're my age. I don't want birthdays.
I hear you.
I wish we could
hear
stop
you.
them.
Of course. No, with the children, they get very excited, as you know, well in advance of their birthday. So
Yeah.
yes.
Several months away.
So I just gave birth to my 3rd child, which is this book.
Oh, you scared
Right
me
in-
there when you said
no,
the 3rd
no.
child. Okay, hold the book up. You stopped too soon.
Here's the book.
It's called Diapers, Daycare, and Deadlines.
Survival Hacks for Super Busy Parents.
Okay. And you are a super busy parent, right?
Yes, sir, I am. Most parents out there are super busy parents.
Yeah.
Who are looking for survival hacks, tips, and tricks to better their household, better their life,
And
live
better
more
take care of their time, more efficient.
Absolutely,
Use their time more efficiently,
to live more
right?
efficiently. My book is really a book that a lot of my friends, when they read it, or customers who purchase it, say, "Gosh, I wish I would have had this book a long time ago, like right after I gave birth."
Well, and it's true, because you're not given, you buy something, you get a manual, right?
Absolutely.
You have a kid, it's like...
You're given no manual.
Yeah.
And a lot of families, too, now live on the other side of the country from their home base or from their parents or from extended family, and it's really hard to find that sort of nice rhythm of life with this new sort of family unit that you're learning to grow into.
Well, then they shouldn't have moved to the other side of the country. They should have stayed close to home, like we used to do.
But I'm really having fun with it, Bob. It's a dream come true. I'm able to help other families.
Right.
And other moms, most importantly, who thank me so much for writing the book, which is really an honor.
And you have a blog.
I do. So
what's the blog?
Blogging is the big cheese.
I gotta figure out how to blog. I don't blog.
Basically, you need a blog.
I need a blog.
So everyone, after I published the book, asked what my blog address was for weeks, and I thought, okay, so I probably need a blog. So I did start a blog, and it's become very popular in a very short amount of time, which is wonderful. But it's www.campcornell.blogspot.com, and basically I take parents and families on a journey with me to find free activities to do with your children.
I used to do that with Zachary when he was young.
I remember.
I used to take him all over the place.
I basically just picked up where you left off.
Really?
So
yeah.
I go on these adventures on my blog and show parents wonderful free events and activities that they can do with their family. One of my most recent blog posts was the Air Force One experience in
That's going on right now, yeah.
Basically, they have a mock replica of Air Force One, and it's free for New Englanders. It is free? It's free because the plane was refurbished right in Quonset. So it's a courtesy to all of our residents, and it's something that a lot of families and parents don't know about, but I like to put those things on the blog so that everybody can enjoy everything that's available out there for families.
Now, how long is it going to be there?
The blog?
No.
The
Air Force One. Air Force One.
It's only there for a few more weeks.
Yeah.
And the plane is decorated to simulate the JFK era, and there's actually his motorcade car is parked right in.
Cut it out. The one he was shot in?
Yikes! I don't know. I don't know if it's his car that he was shot in, but it is.
It's a motorcade car.
I don't know if it is the exact car, but.
I met JFK,
Did you?
I did.
That's amazing.
Yeah, in Providence.
Wow.
When I was a kid. Yeah.
Wow. Did you get a selfie with him?
No, there was no such thing as selfies back in the day. I did get a brooch from him though.
Did you?
I did get a pin, a donkey pin.
Wow.
Which signifies the Democratic Party.
Sure.
I still have it.
Nice.
That's 40 years later. Oh God, 50 years later.
Wow.
Yeah.
Wow. Well, it was very surreal to go to the Air Force One experience and see that motorcade car that JFK himself rode in, and also be able to show my children that car, and also be able to walk down the red carpet, up the stairs to Air Force One, and it's decorated so beautifully, and we're just so lucky to have that experience.
I'm surprised it's free. I'm amazed at that.
It won't be free for long. When the plane moves to its final destination, it's going to be based out of Washington, D.C., from what I am understanding, and also New York City. It will go back and forth between the two major cities. Once it's gone, we won't have the opportunity to see it at all until one travels to one of those major cities and visits the attraction and pays a pretty penny for their tickets.
Right.
But those are the types of things, the exciting things that I feature on my blog.
Wow.
campcornell.blogspot.com.
All right, we're gonna stop right there because we gotta say hi to our band tonight, and then when we come back, we're gonna talk about some of your blog your freebies, some of the things that you can,
Okay,
some
perfect.
of your tips.
Sure.
Some of your
Okay,
tips.
you got
All
it.
right. Who's that? Is that Jesse?
It sure is.
And who's with you there? Who's the guy with you?
My dad, Jack.
That's Dad. That's Dad. Big Jack.
Yes, Big Jack.
Big Jack.
Don't say hi to him on a plane, though.
I get it. Hi, Jack. I got you. My dog's name was Jack, remember? Jack. I had my beagle named Jack.
Yep, I do.
Yeah.
I got
Hi,
a dog,
Jack.
too, named Jack.
Huh?
I got a dog, too, named Jack.
Yes, I'm well trained, Bob.
Whoa.
I know. See
Oh, my God.
I know.
All right. No respect, huh?
See what I've created?
I love you, Dad.
Yeah. Good. That's good. All right. Give us a song.
Sure.
All right, this is from the new record. It's called Come On My Way. You guys can sing it at home, too. It's really easy. It's a sing-along song. It just puts you in a good, upbeat mood. It brings everybody together. I've come so far to turn back now. There's a will, and I know how. I lean into faith when darkness gets shot. We're bound together. Are you with us or not? Come on my way. Come on my way. Come on my way. Hey. Come on my way. Come on my way. Come on my way. Hey. Life is full of changes, not always clear. But you'll find a hero. Look in your fears. You cross that bridge 1,000,000 times. That healing's fire clear in his eyes. So come on my way. Come on my way. Come on my way. Hey. Come on my way. Come on my way. Come on my way, hey. Well, I used to fear the things I couldn't understand. I used to feel life slipping right out of my hands. Nobody's perfect, we've all been broken down. Well, it all comes back together whenever you're around. Come on my way. Come on my way, come on my way, hey. Come on my way, come on my way, come on my way, hey. Well, even when you're down, you never leave the fight. Remember how you said to me, never quit at life. A simple rhyme is what we breathe. It takes the pain away. It opens up the clouds above. It's time to come my way. Come on my way. Come on my way. Come on my way. Hey. Come on my way. Come on my way. Come on my way. Hey. Thank you so much.
Jesse Liam. Is that what we're going to
You
call
got
it?
it.
Right? How you got it? Huh?
You got it.
Forget Dad, though, right? Forget Dad. Jesse
No,
Liam
he's-
and Jack.
He's always here. He's
All
the
right.
Holy Ghost, remember?
No. Father, Son, and the Holy Ghost.
Bravo.
Bravo. Thank you.
guys.
Oh,
Well
they'll be
done.
back. Aren't they good?
They're very good.
What harmony, huh?
Beautiful.
They're like two parts
It's
of the
beautiful.
Bee Gees. Right?
Absolutely.
The harmony is perfect.
It's because we have the same vocal makeup.
Well, yeah, father and son. You know?
You're
You
adopted.
still haven't learned that song for
But
me.
he's adopted. How does that work? I'm just kidding.
You almost had me.
See, that's why I have to joke with him, because he does it back.
Oh, I see. Okay. Well, you guys
Thanks,
are like
guys.
brothers anyway. Anyway, right?
Pretty much. That's what people think.
Yeah.
But then what does that make me? Like I'm like his age? Do I look that old?
Yeah. There you go. All right, we'll leave that
Just
alone
kidding.
before you get yourself in trouble.
It's a long drive home, Bob.
That's right. That's right. And long walk, you mean?
That's right.
It's a long walk. Jan, how you doing?
Good.
Yeah?
Good.
They're good, huh?
They're amazing.
Listen, now, what prompted you to write the book?
Well, what prompted me to write the book was, as you know, back in 2013, when I was pregnant with my daughter, I contracted Lyme disease from a tick bite.
That's unbelievable.
And through
Where did you get the tick bite?
In Rehoboth, Mass, actually.
Really?
In Rehoboth, Massachusetts.
And how long before you realized you got bit?
Oh, 13 months.
Before you knew you got bit?
Well, I knew something was wrong right away because I developed crazy rashes all over my body, and they were crazy enough that I took pictures of them with my cell phone, like we all do. I mean, we have the technology there, so if there's something awry, you take a picture of it, right? So
could have had me take the pictures.
So looking back, I was able to do a timeline through my cell phone, but I went undiagnosed for 13 months, and during that time, I pride myself on being a good mother, and my family and my children are my first priority. So during the time that I was gravely ill, I still was striving to be that mom and that provider that my family needed me to be. So I really needed to pare my life down, simplify, live in a minimalistic way, and figure out ways to really make my household more efficient, which is where I came up with the hacks that are in this book. And a lot of my girlfriends nationwide, I would post a hack here or there online.
What's a hack?
A hack. A hack is a trick. It's a tip. It's something. It's a life hack. It's something that is a secret, if you will, a tip to make things easier and better.
Okay.
So I started compiling all of these different hacks for myself, and then I would post every once in a while a hack on social media, and my girlfriends would go crazy. They would say, "Oh my gosh, Jan, keep them coming. You know, I love this." And then my husband suggested, he said, "Jan, you know, you've sort of gotten things to a science. Why don't you publish?" And that's sort of where the idea came from. And I've really just been having so much fun since I published.
Now, how did you get published? Because I was thinking about writing a book. I have I've been keeping a diary for like 35, 38 years.
So it's very difficult to find the right publisher, the right process for you. I stumbled, I made so many mistakes. It's easy to make mistakes when you're publishing, but I finally found a publisher that I was ecstatic to publish with. And my publisher's Lulu Publishing out of North Carolina, and they've been wonderful. And like I said, I made mistakes along the way, which everybody does when you embark on such a journey.
Right.
But, you know, it's here, it's published. We did it.
Now, when did that come out? When did it finally
So
arrive?
it finally came out July of 2017.
Okay.
So do you want to learn some secret hacks?
Yeah. Okay.
Okay.
Give me a secret hack.
So
Again, a hack is.
a hack is like a secret tip to make something easier.
Okay.
One thing I pride myself on is lowering costs, being frugal, because when you're fighting Lyme disease or if you have a disabled child, every family has that one thing that possibly might take up a lot of funds.
Drains.
I wanted to be
their
nice
funds.
when I was trying to find nice words, but every family has one thing that they have to devote a lot of finances to, and I definitely spent a pretty penny nursing myself back to health from Lyme disease, and during that process, I didn't want my children to suffer during our daily activities, so I had to find ways to save money. So here's a fun tip. So my blog is geared towards Rhode Islanders, residents of Massachusetts as well, and Connecticut. And one thing I found is Ocean State Libraries, this is a very good one.
Right.
Ocean State Libraries, you can type in their keyword search bank and just put the words museum passes.
Ocean State Library.
Ocean State
Now,
Libraries.
who's a member of the Ocean State Library?
Okay, so it's any resident who owns a library card or who is in possession of a library card in the state of
I
Rhode
don't
Island.
have a library
Oh my gosh,
card.
you totally need one because the library is not what you think it is anymore. It's so progressive. So you can go right online to oceanstatelibraries.com.
Oh, and sign up?
Yes, it's very simple. It's very
I can get a library card online?
Absolutely. So again, you type into the keyword search, museum passes. You will get several hundred hits. In our state of Rhode Island, every single library owns a set of free museum passes and attraction passes. So you can visit basically every single attraction in New England free.
Really?
If you're willing to get in your car and go pick up the passes and check them out and then return them after you've visited
Oh, they give
the
you a
museum.
physical pass.
They give you a physical pass that the
Good for that day.
good for that day. And there's all different packages for the Pawtucket Red Sox, for the Mystic Aquarium, biomes in North Kingstown,
I had them on the show before.
Edaville.
I've been there.
It's very expensive. If you don't have a pass, it's very expensive.
Right.
Edaville, Southwick Zoo, Capron Zoo in Massachusetts.
I love Southwick Zoo.
Absolutely, but
Betsy's been on the show. She used to bring
wow.
animals.
Oh, that's so fabulous.
I had a baby, what do you call them?
Koala?
A koala bear, and I also had, one time I had a kangaroo, baby kangaroo.
Wow.
And then I had this other zoo from New Hampshire, and they brought a baby Bengal tiger, and they put it
Sure.
on my desk, and they had me with a piece of steak, like a 3-pound piece of steak.
I don't know
This
if I would
thing was
hold a steak in front of a tiger.
This thing was a baby. It's this big, but he had paws bigger than my hand. And when I put that steak out, he was my best friend. But
Wow.
He was scary at a 1 month old or 2 months old, whatever he was. But it was cool. And yeah, I've had
Absolutely.
snakes. I've had and Betsy used to always bring stuff.
But for your average family to attend any attraction, whether it's the movies, the zoo, a museum, I joke with my mom friends that it's triple digits. It's
Sure.
triple digits
Yep.
every time you leave your house. You're
Yep.
looking at $100, which
Well, if you got two or more kids, yeah.
absolutely. And if both, if you have 2 adults and multiple children, again, every time you leave the house, triple digits. So I really strive on my blog and with my book to make the quality of life better and less expensive for the average American family. And for myself. I've done a lot of learning during the process, and it's been great. It really has.
So and you can go to any library and do this? Or
Absolutely.
You bounce back and forth?
You just go right online. Like there's several libraries that have the better museum passes.
Ah.
Like the Cumberland Library has amazing passes. The Bristol Library has amazing passes. And like I said,
How
if you're,
about Providence?
I'm not sure
Because
about.
they got a couple libraries in Providence.
Sure, I'm not sure about Providence. I just know that there's several libraries that have, the golden binder of all the museum passes. But again, it's something that everybody can do. Anybody can do it. There's no secret, or you just have to have a library card. That's it.
Wow, that is so cool.
Thank you.
'Cause I can remember having Zachary on an adventure, getting on a train in South Attleboro.
Sure.
And we did this to show families that who were home doing nothing,
Yeah.
sitting in front of a television, get off your butt and take the kids out somewhere.
Absolutely, and that's the biggest issue now is just keeping kids off the electronics and finding something quality to do
Right.
with
right.
them.
Yeah, we went New England Aquarium. Another time we went to Chinatown.
Sure.
Another time went to the Science Museum up in Boston. And what people don't know is, and this is even better what you got, but back then what we had was the kids get in for free under 6 years old anyway.
Sure.
And the ride to Boston was free, and the ride for me was only like $12 round trip. I mean, that's unbelievable. You get off the train in Boston, you walk 2 or 3 blocks, and you go to the Science Museum.
Well, and I think a lot of parents out there in the age of Facebook and social media, they're not going to say on Facebook, what's something free to do this weekend, guys? Nobody
Right,
wants
right.
to admit that they're
Right.
looking for something free to
Yeah.
do, which is why my blog has become very popular in a short amount of time.
Well, that's very cool. You got to
Thank
teach me
you.
how to do the blog because I should be
You
on
need
a
a
blog.
blog.
I need a blog somewhere. I need blogging somewhere. So the Lyme disease now, how has that affected you still? Are you still bothering you?
I'm good now. I'm still extremely active in the Lyme disease community because there is so much need out there, guys. Lyme disease is absolutely destroying communities. It's the suffering that I hear about and that I'm exposed to on a daily basis through social media and through all the organizations that I'm involved in. It's just tremendous. And I do want to say that this Saturday is the Central Massachusetts Lyme Disease Conference.
Right.
Okay. It's at the Worcester High School. Tickets are only $10
Right.
if you purchase them ahead of time. They're $20 at the door, but this conference is from 8:30 in the morning till 4:30 in the afternoon, and they have doctors coming from all over New England. They have authors, doctors, Lyme literate physicians and different organizations that will be teaching anybody who wants to learn. If you've been recently affected by Lyme disease, or if you've been struggling for a long time, or if you know somebody who is struggling and you just want to go learn more, this is a very unique conference. They don't have these in other parts of the country. So it's a great opportunity for you to go and learn more about Lyme.
I told you this. I had a tick on my back. Didn't even know it.
Sure.
Until the next day, I said to my tenant, I said, "Can you do me a favor?" I lifted up my shirt. She said, "I have something on my back." And she started screaming. I picked it off, or she picked it off.
Sure.
It was huge. It was been on my back all day or all
Great.
night. But fortunately,
Lovely.
because I noticed it within a day, they immediately put me on antibiotics.
And you're very lucky.
Yeah.
The ticks now, you're talking about a big tick that you pulled off your back, but many of the ticks now are smaller than a tiny little fleck of pepper, and they're just so easy to miss. They're missed probably more than half of the time until a child or a senior, or even just someone in their between 20s and 40s just starts developing crazy symptoms all of a sudden. So it's crazy, but yes, this is the Central Mass Lyme Conference. It's this Saturday from 8:30 to 4:30. It's at the Worcester High School. Again, it's a very rare opportunity. They will also have different diagnostic companies and different, not necessarily pharmaceutical, but different vendors at the conference that will be able to speak to patients as well. Oh, cool. And not just patients, anybody can go.
This Saturday, that's the 23rd of September.
Yes, sir, it is. 23rd of September, Worcester Technical High, 8:30 in the morning.
All right. Well, guys, give us another song, because we're coming back with another author. You think? Huh? Jack and Jesse.
This is from the previous record. It's called Yeah, Yeah, Dance. When I say yeah, yeah, you say dance. Yeah. It's time for me to lay it down. Someday I'll be the hottest ticket around. I may not work from 9 to 5. I may not own the coolest ride. I was born to rock your feet. All I need is a microphone and a funky beat. Everybody, come on, let's dance. Don't stop, just take a chance. Go on and clap your hands. Yeah, 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 dance. Everybody, come on, let's dance. Don't stop, just take a chance. Go on and clap your hands. Yeah, yeah, yeah. It's time to spin it back. Feel that magic in the air. Live a life in harmony, even when it ain't fair. Feel the summer breeze, hanging with my pa. We could sing you anything, Beatles to ska. I was born to rock your feet. All I need is a microphone and a funky beat. Everybody, come on, let's dance. Don't stop, just Just take a chance, go on and clap your hands. Yeah, yeah, yeah. Dance, everybody, come on, let's dance. Don't stop, just take a chance, go on and clap your hands. Yeah, yeah, yeah. It's summertime. It's summertime. Summertime. Everybody, come on, let's dance. Don't stop, just take a chance. Go on and clap your hands. Yeah, yeah, yeah. Everybody, come on, let's dance. Don't stop, just take a chance. Go on and clap your hands. Yeah, yeah, yeah. One more time. Everybody, come on, let's dance. Don't stop, just take a chance. Go on and clap your hands. Yeah, yeah, yeah. Dance.
Whoa, there you go. Jesse, Liam, and Dad Jack. How do you like that, huh? All right, thank you. And hey, we got someone new on the set here. Hey, John or Johnny? Dr. John Liu.
Yes, absolutely.
Right?
Yep, that's me.
Where you from?
I'm from Rhode Island, so I grew up about 3 miles down the street in Rumford.
Rumford, Rhode
Yeah.
Island. Wow. And you're a doctor? What kind of doctor?
A medical doctor.
You are a medical doctor.
I am, yes.
And here we are. We're originally talking about, like you heard, we're talking about mostly for children, kids, right? And now we're going to talk about
Adults.
us older folks, right? Mostly Medicare, right? Right?
Absolutely, yeah.
Now you have a book. Where's your book?
Right over here.
Yeah, let's see
Retiree's
this book.
Guide to Medicare, huh?
That's it.
Now what prompted you to write this book?
So actually, I started a company called Doctor's Choice when I graduated medical school because I felt like there was no education about health insurance for physicians. And a lot of patients were confused. I was up in a primary care office in North Smithfield, and about a quarter of the patients were on Medicare. So initially, I started the company by giving a lot of seminars about Medicare, the ABCDs, and people really wanted to learn more and more. So instead of being able to just deliver one seminar at a time, I pretty much put as much knowledge as I could into a book. It's about 100 pages. It's easy to read so that anybody can get access to the knowledge that took about overall a couple thousand hours of research.
Really?
Wow.
Now, what if you had to pick out a highlight something Medicare that has
Sure.
to do with Medicare? What would you have to say? What would you
Well,
say?
the thing with Medicare is that it seems daunting at first. I mean, when somebody turns 65, you get all this mail. You kill a tree every single day in the mail.
Kill a tree every
Yeah.
single day?
So yeah, don't tell Greenpeace. And essentially, you get all this mail, and it's a lot of solicitations, and people are really confused. And the biggest thing with Medicare is it's really understanding the ABCDs of Medicare. It's not about the what insurance company to pick, or what your insurance agent is telling you. It's really between understanding your situation, understanding your particular health, your lifestyle, whether you're going to be staying local, you're going to be a snowbird, and also your risk tolerance. Are you somebody that's going to be okay with a pay-as-you-go type of plan, or sort of the Cadillac all-you-can-eat plan? So that's the biggest takeaway, is really figuring out which bucket do you fall into. Do you want somebody that wants as much coverage as possible because
Right.
you're unhealthy or you travel a lot? Or are you somebody that's pretty healthy, that stays local, and you're okay with a pay-as-you-go? Figure out which bucket you're in before looking at the companies out there.
Interesting. I can see where that would be really overwhelming for somebody.
Yes. And picking
know
the
what to
wrong
do.
bucket is
Yeah,
could
what if
be-
you pick a wrong bucket?
Yeah, well, that's
Yeah.
where things get more confusing, is that, in Medicare, some of the plans are standardized based on 47 states, and for our Massachusetts residents, it's one of the 3 states that are standardized a little bit differently. And depending on where you live, if you pick the wrong bucket, it might be very hard for you to get back in, because with Medicare,
wow.
with certain supplemental plans, there's still medical underwriting because it's secondary insurance.
So why did you say Massachusetts?
So in Massachusetts, Minnesota, and Wisconsin, the plans are a little bit different, and the rules can be different as well.
Bad or good?
The price is a little bit higher, but in terms, it's easier to get into the more Cadillac plans.
Oh yeah. And all the plans start what, October, November?
Yeah, so we're coming up on the open enrollment period, which is October 15th to December 7th. Now, that's
Right.
not for people that's new to Medicare. It's people that's already on Medicare. So
Right.
that's when all the new stuff comes in. You see the billboards, you get lots of mail, you get some phone calls, commercials, the We Care commercials.
Oh yeah,
And,
yeah. They care. All
Yeah,
right.
and then so what ends up happening is people that are on a Medicare plan, they've got to figure out whether they want to stay or they want to go and change their plans. And every single year things are different. So what we're seeing now is that, for this year there are some cutbacks, some new taxes that are introduced for Medicare. So some of the insurance companies are feeling the pinch. So they might be pulling back benefits in some situations.
Right.
Some might be adding some more benefits.
Well, how do they get away with, you sign up for Medicare, you sign up for a particular program, and after looking at what kind of prescriptions they cover, say, and you look at the book and it said, oh, they cover this, they cover that, they cover this. You sign up for it, and 4 months later, they send you a letter that we don't cover that anymore. How do they get away with that?
Yeah, so technically, they're supposed to keep everything the
They
same.
are.
Yeah.
For at least
Absolutely.
a year, right? You signed up for the year,
Sure.
right?
Right, especially prescriptions, it's a huge mystery because technically they're supposed to keep things the same for the entire year. But a lot of times what companies are now introducing is the concept of co-insurance. So the difference between a copay and a co-insurance is that copay is a flat dollar amount, let's say $20, versus co-insurance is a percentage, let's say 20%.
Right, sure.
So 20% of a certain drug can fluctuate. So the drugs themselves, the
Yeah.
full price of the drugs themselves, they fluctuate like the stock market every single day.
Yep.
So there was this one time when antibiotics went up 20 times because there was a shortage. So your 20% of that drug can fluctuate throughout the year. So you go into your pharmacy and you're saying, this used to cost me $4, why is it costing me $20 today?
Yeah.
So we see that a lot, and unfortunately that's something that I wish more people would address, because people that are on Medicare, typically they're on a fixed income, and you can't really budget for those surprises regardless, just because there's no Cadillac drug plan out there.
Right, right. I was going to ask you, what's the Cadillac plan?
Yeah.
Because I'm getting killed, and I have 2 coverages.
Wow.
You're lucky.
But I'm paying for it, and I still get bills.
Wow.
Yeah.
Why is that? I mean, is there a plan called the F plan that's supposed to be a better plan than all the other plans?
So the F plan is the most popular plan currently in terms of number of enrollments, and it's what I call the full coverage plan, because so with Medicare there's all these different letters, right? The ABCDs, and they'll drive you nuts. So A covers you in the hospital and B covers you at the doctor's, but there's some gaps in coverage. So every
Wow.
time you go into the hospital, you're on the hook for about a $1,300 deductible.
Yes, I got hit
Wow.
with that when
With
I
Part
went in
B-
for my knee.
Yeah, and with Part B, there's that 80-20, meaning that you pay 20% of who knows what.
Got hit with that.
And so if you get $1 million outpatient, so we had some people that we've helped that had pacemakers, right? And to switch out a pacemaker, it's $50,000. So 20% of that
my
is
word.
a lot of museum passes. So the
Wow, that is a lot of museum passes.
so the supplemental plan F just comes in and covers that 100%. Meaning
Really?
that when you go to the doctor, when you go to the hospital, you don't pay a dime.
What supplemental plan is that?
That's the F plan.
Oh, it is the F plan.
Oh, there you go. The
yeah.
F plan.
But they're getting rid of it by
Oh,
2020.
lovely. Great.
Oh, there you
Of
go.
course.
So there's a new plan that's coming out that's going to be, I think,
The FU plan, they call it.
pretty close. It's called the G plan. You got to pay a small deductible, but otherwise you're covered. So it's still, people are still in good shape. So you can still get that, Cadillac coverage.
But if you have the
reasonable
F
amount.
plan, you can't get something to do with prescriptions if you have the F plan.
Correct. Yeah, with all the supplemental plans, you've got to get a separate Part D drug plan. So you hit it right on the nail. And with the drug plans, for example, in Rhode Island or in Massachusetts or in most parts of the country, there's over 20 different plans to choose from.
Which is crazy.
Oh my goodness.
Exactly.
I
But-
could see why you could write a book on that,
Yeah, and
on all of
it's-
this.
And it changes every year. So what drugs they cover, what pharmacies they cover, and at what tier they cover it at could change. So that's why it's really important, because a lot of people we hear, we don't want change. I'm happy with the plan that I have. I'm just going
Right.
to keep it. And then they go to the drugstore in January, and boom, there's a surprise.
Yeah,
Everything's different.
Or like
Exactly.
I said, I got my prescriptions they cover, and then all of a sudden they're not covering it.
Lovely.
Right.
Arbitrarily, they just decide I'm not covering it anymore. Now you've got to pay $180 for that prescription or
Great.
whatever it is. Yeah.
Surprise.
Surprise.
Yeah. So we help thousands of folks every single year with that. And so in addition to the book, so the book is really one of the pieces of what we do. So the majority of what we do every single day is we help retirees navigate Medicare. So
Now, where do you do this?
we're in Warwick. So we're right in the Social Security building on Quaker Lane.
Oh, yeah?
And our office is open 9 to 5, so anybody can walk in. But primarily, we work with a lot of the big companies, Lifespan, Brown University, for a lot of the retirees that come through. So we do the education for them, seminars for a lot of companies, as well as our team handles one-on-one consultations as well. So I have a team of 7 folks currently who sit down with individuals either over the phone or in person, and we
Yep.
walk them through all of this.
So can anyone go to your office?
Yes, anybody that's eligible for Medicare can use our services, and actually we're able
Wow.
to offer it for no cost.
Really?
And the reason, so when I first started the company, I quickly realized that, I mean, there were attorneys charging $1,000, $2,000 for what we do.
Wow.
And we quickly realized that people that really need the service are people that can't afford this.
Sure.
Because if you can
Right.
afford a couple $1,000s to hire somebody, chances are you're going to be okay in terms of cost. So we actually worked out a deal with the insurance company. So similarly to, essentially we're insurance agents, except we're independent. So that means that we work with all the major insurance companies in Rhode Island. We work with both Blue Cross and United. That way we can sit down and really give you an unbiased overview of what to expect. And pretty much what they pay us is regulated by the government. So we don't really have an incentive to put you in one plan versus another. We just want to make
Interesting.
sure that you're in the right place.
So what do you got in Rhode Island? You got Blue Cross and you got United. Are those the only two plans in Rhode Island?
Those are the two big players, but for supplemental plans, for example, we've got a dozen or so different ones to choose from.
Or AARP? you
That's
got-
United Health.
Oh, yeah.
Yeah, so
Wow.
United Health pays AARP to use the brand. So whenever you hear AARP, it's synonymous with United Health. We've also got a couple of other drug plans. Humana, that's the Humana Walmart plan that we hear a lot. If you could ever go to Walmart during the open enrollment, there's big signs out there. And then there's a Silver Script drug plan, which is actually a company that's owned by CVS.
Interesting.
And they're one of the more popular drug plans out there. So there's tons of different plans out there, but in Rhode Island, again, two big players are still United Health and Blue Cross.
Okay, now I have them both, United and Blue Cross, and I still get bills.
Wow.
So, I mean, in your situation, it's pretty unique because, well, actually, not so much anymore because a lot of people are working past 65.
Yeah,
Right? A third of baby boomers are working past 65. And it's
because you have to.
Well, you have to,
Sure.
but they say 60 is the new 40 according to AARP. So,
Really?
yeah, you got a lot of years ahead of you. And essentially, what people are really confused about is how everything works with their employer plan. And employers are having trouble too because their benefits offices are so swamped with the new healthcare regulation for group health and things going up in price and up into deductibles
Right.
that a lot of times employers have trouble educating people turning 65 that are working at the companies. And the biggest issue with that is, unfortunately, there's a lot of rules that employers have to follow, what they can and can't say. So a lot of employers are confused, so they just say, we're not going to do it.
Wow.
So that's when we come in and we
Wow.
provide the education to make sure that, if you're working, it might not make sense for you to go on Medicare. It might not make sense for you to have your Part B and sign up for a supplemental or drug plan because your work plan, if you work for a big company, like the state of Rhode Island, your state plan is going to be primary coverage.
Right.
And Medicare is going to be secondary, and Medicare may not cover everything. So you may not need to pay that extra for Part B, pick up a supplemental plan, and be double, triple covered.
So maybe I don't need to be.
Yeah.
You need all the coverage.
I need
Yeah,
all
you
the
may need
coverage.
everything.
You need
But
everything.
why do I get nailed with? I shouldn't even pay a copay with two coverages.
It used to be
I
that way.
agree. I
Right?
agree 100%.
Yeah, but nowadays we see a lot of times where who's primary, who's secondary, the companies fight it out, and ultimately the consumer gets left holding the bag.
Yeah.
Yeah, so it becomes a very confusing
Wow.
process.
Kind of ridiculous. Yeah. Well, I went in the hospital with a knee. I had a knee infection, and they replaced my knee, and I got infected, and I had to go in the hospital. And I spent 86 days between the hospital and recovery
Yikes.
center.
No kidding. Wow.
And I got nailed.
How was the food?
Terrible.
Get the green Jello.
Yeah. No, actually, I didn't stay in the hospital. They put me in a nursing facility or whatever.
Rehab.
Like a rehab facility. And the food was okay. The food was okay. It was better than hospital food.
You probably ordered in though, knowing.
I ordered out.
Or yes.
Yeah, I ordered out a lot. Yeah, I had Chinese food delivered all the time. I had pizza delivered. Yeah.
Sure.
Oh
I
yeah.
bet.
I hope you shared.
Yeah. I even did my show from the facility.
Wow.
I did several shows from the facility.
Good for you.
Yeah. Because I would not be stopped. I would not be
Sure.
stopped from doing
So
my
you should have
show.
blogged. I mean,
Yeah, that's where the blog
Perfect
would come
timing.
in.
Yeah, I know it, huh?
So what is the name of your business in Warwick?
it's called Doctor's Choice.
Doctor's
Doctor's Choice.
Because I know a few people that I would like to recommend that. to.
Yes. I want to go in just to go through the whole thing.
Get an analysis.
Yeah.
Yeah, come on in. We got free coffee. We get
Free
some
coffee.
nice organic gummies.
Is
and-
coffee good for you, by the way?
It depends on who you ask. Everything in moderation.
I know. Well, I had a high school principal used to say that, and if everybody did what he said, and it's true, in moderation, whether you're a gambler, whether
Sure.
you're a drinker, whether you're a smoker, whether you're anything, if you did it in moderation, you wouldn't have a problem.
Right.
It's when people go overboard. He was my high school
Very
principal.
true.
Every year he'd say that 3 or 4 times a year. You know, whether it be the beginning of the year when we went on school vacation or the end of the year, whatever. He always brought that up.
Absolutely. So you got to have everything in moderation, but you got to enjoy life a little bit too. That's another thing is that we just started posting a lot of content on Facebook. So we realized that a lot of baby boomers are going on Facebook because their kids are on, their grandkids are on.
Right.
And what we want to do is that living life a little bit. You know, we wanted Jan's going to be on our feed, giving the advice on how to get grandkids out of the house. You know, how to get those free passes so that you save a lot of money and you get to have a lot of fun, because ultimately when you're nearing retirement or what they call the fourth quarter of life, is you got to have as much, you've saved all this time, right? Baby boomers control 70% of the country's wealth, and because of that, you got to enjoy it. You can't take it with you, and who knows what inflation's going to do. So
And you don't want to give it to those kids.
Hey.
So essentially, what we try to do is that we try to post a lot of information on how do you live healthy, how do you stay happy, and,
Right.
and one of the things that we find out is that especially if you're a male and you held a very prestigious position when you were working, if you don't have 5 things to do after retirement, you're very likely to
pass on.
Yeah.
I firmly believe that. That's why I don't like the idea of retiring. I just
keep
don't.
on working,
Agree.
have fun.
Yeah, because you feel like you're worth something when
Sure.
you're working, and when
Right.
you're used to being busy, it's tough to not be busy. I don't know how people, especially young people, I see them, like I'm redoing a house. I gutted out a whole house, and I'm still working a full-time job. And I'm out there working on the house, and I see young guys in their 20s across the street sitting down watching me work.
You can probably run circles around those guys.
Yeah,
Yeah.
it's
That-
amazing
yeah,
to
that-
me
Yeah,
that would-
how lazy
Old man
they
yeah.
are.
muscles.
It's unbelievable.
I never sit down. I can't remember. I think this is the first time I've sat in probably weeks.
Really?
Well, no. I mean, how often do you just sit,
Exactly.
Never.
Yeah.
Yeah.
right?
Yeah. Yeah, I don't know how they do it. I don't know how people can just want to do nothing all day.
We also got to look forward to something too. I mean, doing something every day, you get something to look forward to. So one of
Right.
the things that
Right,
I've
right.
implemented is just asking yourself every single day, what are you looking forward to?
And, all right, what's going on in Washington that's affecting
Yeah, so
us here in Rhode Island?
I mean, immediately there's some new taxes to Medicare that are being implemented this year, which
New taxes?
so a lot of the Medicare taxes, Affordable
God.
Care Act.
Wow.
Yeah, but then, so I think consumers are going to feel it more on the downstream in terms of their benefits. Sometimes some companies will cut back on some benefits depending on what company. But also there's this whole Medicare for All that Bernie Sanders is touting. That's getting a lot of
now that's
press.
socialized medicine, right? Basically.
Yeah, well, essentially Medicare is the first single-payer system. If you look at the data of what's going on in healthcare, over 50% of healthcare expenditures in the United States can be traced back to some type of governmental organization. Whether it's Medicare, Medicaid, whether it's Obamacare, whether it's the federal employee program, military spending. So more than half the costs are already paid for by
the Fed.
The feds. So the feds are the state. So essentially what we're looking at, and the reason why healthcare is so expensive is the transaction cost. I mean, we did our own independent study, and we estimate after talking to doctors, sure that insurance companies can devote 15% to administrative costs according to the Affordable Care Act, but essentially, if you look at all the transaction costs associated with healthcare,
Right.
every dollar that you pay in premiums, we venture somewhere 30, 40 cents gets to the provider, actually to the provider.
Cut it out.
Everything else is, it takes 10
70% is administration costs and profit?
That doesn't surprise
If you
me.
look at what it costs to administer everything on both the provider's end, that means the provider hiring staff to deal with all the paperwork and going back and forth, and the insurance companies.
Lots of
Did you
paperwork.
hear that?
Doing
Is that
back and forth.
ridiculous?
Yeah, imagine going to the store and using your American Express, and 60% is already gone by the time you swipe.
Wow. That's unbelievable.
It
Yeah.
is.
Oh,
So
That
we
really
got to
is.
fix that.
Yeah.
Well, and doctors feel that pinch too.
Oh, yeah.
I mean,
Well, it's less money going to them.
Sure.
Because it's going to administration, it's going to, and that's a big joke about nonprofits, because a nonprofit, these guys are making $4, $5, $6 million a year
Right.
in wages, and then you get the golden parachutes and making $30 million a year. They're making $6 or $7 million a year in pay, and then they get the golden parachute when they retire at $30, $40 million.
Right.
And they call that nonprofit.
Exactly. And that's the thing that consumers get hurt. And also, if you talk to any provider nowadays, they're not happy. I mean, the only
Absolutely.
providers nowadays that are happy are the ones that are concierge medicine, where they charge you cash and they have a full panel of patients, and they really control their own destiny. Otherwise, I think that we do need a new system to at least try something new.
Well, I think the Bernie Sanders in theory, makes a lot of sense, because it would eliminate what you just said, eliminate a lot of that, because they wouldn't have to advertise, number one. They wouldn't have to spend all that money advertising. They wouldn't have to spend all that money administrating as much anyway.
Yeah.
Right?
Well, we're
and
in the
more
Medicare
money could
business.
go to where it's supposed to go.
Exactly. Yeah. I mean, we're in the Medicare business, and I know that in this country, we're a capitalist society. Even if we have Medicare for all, we're going to have privatized versions of Medicare, which for nowadays it's called Medicare Part C or Medicare Advantage. And the drug companies, the Part D plans are all privatized too. So we're going to still have some quasi-public mix. But I'm hoping that, for me personally, seeing what people going on Medicare have, I can't wait to go on Medicare. Can't wait to get my plan.
Can't wait to get. No, you don't want to wait. No, that means you're old if you were getting on
It's
Medicare.
Medicare for all, and maybe we'll get something.
Can't wait.
We'll get the
to
Cadillac.
Wow, I can't wait to on Medicare.
I
They
think
say you
that's
get
the
funner
first
with
time
age.
I've ever heard that.
Yeah, I want to be 65.
I get my Social Security and
Those
have 5 things
66.
to do. Yeah, well, who knows what it's going to be down the road.
Yeah.
You have a long way to go.
Yeah.
Hopefully you have a long way to go.
Yeah,
course.
can't have too much fun in moderation.
So they can go. Where is the place? You said it's in Warwick. Where
Yeah,
is
so
it?
we're 30 Quaker Lane. We're right in the Social Security building. We're actually right across the hall from Social Security on the first floor.
30 Quaker
That's
Lane.
why. That's if I recall correctly. That's by the Kent County Courthouse. The
Exactly.
new Kent County
Oh,
Courthouse.
okay.
Yes.
Between the courthouse and Inskip.
Oh, all right.
So you can get your car, you can get some lawsuits done, and stop by for
Treehouse
coffee.
Tavern is over there.
Treehouse Tavern.
Oh, really?
It's a great place.
The
Yeah.
Treehouse Tavern.
It's neat, yeah.
Oh, yeah, it's very nice.
It's like a little house you go in.
So why does healthcare cost so much? Because of the administration costs?
Well, I think healthcare costs so much. Yeah, absolutely. I mean, there's a lot of middlemen involved in the process. And I think also healthcare costs so much because the cost of developing new therapies is tremendous. So you can't just blame it on, you can't blame it on providers, you can't blame it on patients just spending a lot of money, you can't blame it on the companies, because the system itself, it costs $1 billion to $2 billion, depending on what studies you read, to develop a drug.
Right.
And then you got all these distribution costs. So in order to recoup the cost of the drug, I mean, the drug might cost a couple of cents, but they're going to charge you a couple $1,000s for it, because to develop their next drug, they got to go through the FDA. They've got to go through all these phases, phase 1, 2, and 3 of clinical trials. And before starting this business, I was in the drug discovery field as well, and we were pioneering stem cell therapy and going through FDA approval. The process is tremendous. You can spend 10, 20 years on the process.
And is that why the same drug is cheaper in Canada or in Mexico, because they don't
Absolutely.
have the regulations that we have? Is that why?
Yeah, so we have a lot of folks that are buying their drugs from Canada, buying their drugs from Mexico.
Wow.
And you got to watch out for that as well, because you got to make sure you're getting it from a reputable source.
Right, bogus drugs, fake drugs.
Exactly.
Right?
That would make me a little nervous, I think.
Yeah.
Yeah. So actually, we're doing a study on how do you actually do that. So we're hopefully going to be publishing that within the next couple of months. A guide to really, because if you read the Medicare book, it actually tells you, there's a line in there that says some folks may buy it from Canada. So it's not like it's
Wow.
illegal for your personal use. The Medicare book says it. So we got to find a safer way for people to actually do it.
Wow. What's the biggest takeaway from your book?
Yes, the biggest takeaway is ignore a lot of the junk mail that you get. Focus on yourself first. I mean, it's the idea of self-love that we preach through everything, right? you gotta figure out what really works out for you. Don't just get what your neighbor gets. Figure out the 3 major components that we look at in terms of
Right.
our algorithm when we sit down with you is 1, your health. Right? Are you somebody that goes to the doctors a lot of times? Once a year checkup kind of person? What are you? 2 is in terms of and also your drugs as well. 2, in terms of your preference. Are you somebody that says, I'm healthy today, but I don't know what's going to happen down the road, so I want to be
Right.
protected? Or are
Right.
you somebody that says, well, I'll put the difference in the bank? And 3rd is your lifestyle. Are you somebody that's in Rhode Island, you don't cross bridges? Or are you somebody that's a snowbird, you're going to be getting your Southwest card and you're going to be racking up those points everywhere so you can go to Florida every year? So based on those factors, in of course a few other factors that are unique to special situations, we're able to recommend a plan for you. And again, for you, it's really focusing on you, what you want, not what the advertisements are telling you.
Now, what about these plans that, like, I travel, or like I go on the other side of the world sometime, and I buy insurance. And I bought the insurance a couple of times, and I've never made out on them, even when I've had.
Well, that's good.
Yeah, but it's not only for the health. For anything, you buy the insurance.
That's smart.
And
Yeah.
will they ever cover stuff? These insurance companies, these policies?
Yes, typically some supplemental plans will cover you typically for $50,000 of international travel.
Really?
So the plans, the supplemental plans, the Cadillac plans, they cover you for pretty much every doctor, every hospital that takes Medicare in the entire country. It's as if you were in network. And then if you travel out of the country, they'll cover you for a little bit as well.
All right. Well, thank you for stopping by. No, the name of the book again
Both
is?
of our books.
Yeah.
Those are books.
Here's
Put it up
yours.
there.
Here's mine.
Get the books ready. Get the guys ready. There's the books.
Okay, so we have Diapers, Daycare, and Deadlines, Survival Hacks for Super Busy Parents by Jan Cornell, and
Then the Retiree's Guide to Medicare, what your insurance company doesn't want you to know.
both can be found on Amazon.com.
That's right. There you go.
You got it.
I'll be ordering yours.
And I'll be ordering yours.
All right. And take us out of here.
You
And
go to
thank you for stopping by.
jessewilliam.com For our schedule, so you can see the schedule and to order the
I
CDs.
know. You got
That's
some
such a
great.
busy
You got some
summer.
great
We're gonna
spots
continue
coming up.
it.
You got Roger Williams
fall.
Park. You got Harbor Lights Marina. You got Smith Castle. The Walls Public Library. Yogi Bear's Jellystone.
Park.
That's in Sturbridge. I've been there.
Yep. Yep,
And
many
the
years.
Autumn Fest, one of my
The Autumn
favorite
Fest.
places. I love the
Woonsocket.
Autumn Fest in Woonsocket. Oh, the
October
food is,
9th.
food
Autumn
is
Fest.
awesome.
Don't
there.
miss it.
All right, folks. Thanks for spending an hour with Bob.
Thanks for
Bob,
having us.
Thank you so much.
Thank you.
Always a pleasure.
Don't worry about a thing. Every little thing is gonna be alright. I'm singing, don't worry about a thing. Every little thing is gonna be alright. Rise up this morning, smile with the rising sun. 3 little birds perched by my doorstep, singing sweet songs, oh, melodies pure and true, singing, this is my message to you. No woman, no cry. No woman, no cry. No woman, no cry. No woman, no cry. It's been a long time since I've got you on my mind. Ooh, so steer it up, little darling, steer it up. Oh yeah, come on now, steer it up. Whoa, little darling, steer it up. Yeah, baby. 'Cause everything's gonna be alright. 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 Everything's gonna be alright with one love, one heart. Let's get together and feel alright. One